Health disparities for immigrants in the United States are a growing concern for public health professionals, policymakers, and advocates. Health disparities refer to differences in health outcomes between groups of people and are often shaped by social, economic, and environmental factors. Immigrants in the United States, particularly those who are low income, face a variety of barriers to accessing quality health care, which can contribute to a range of health disparities. One major barrier for accessing health care for immigrants is the lack of health insurance. Immigrants are less likely than U.S.-born individuals to have health insurance coverage, with the uninsurance rate among non-citizen immigrants being particularly high. This can make it difficult for immigrants to afford necessary medical care, including preventative care, which can lead to chronic health conditions and higher rates of hospitalization. Another challenge facing immigrants in the United States is language barriers. Many immigrants may not speak English fluently, which can make it difficult for them to communicate with healthcare providers and understand medical instructions. This can lead to misunderstandings about diagnoses, treatments, and medications, which may result in poor health outcomes. In addition to language barriers, immigrants may also face cultural barriers to healthcare. Some immigrants may come from cultures that approach healthcare and illness differently than mainstream American culture, which then in turn makes it difficult for them to navigate the U.S. healthcare system. This can lead to underutilization of healthcare services, delayed diagnoses, and increased morbidity and mortality. Immigrants may also face discrimination and stigma when seeking healthcare. Some healthcare providers may even harbor bias or prejudice against immigrants, leading to substandard care or outright denial of care. This can have serious consequences for immigrant health, including delayed diagnosis, inadequate treatment, and poorer health outcomes. Finally, immigrants may face challenges accessing healthcare due to their immigration status. Undocumented immigrants are not eligible for most public insurance programs such as Medicaid and may be hesitant to seek health care for fear of deportation. This can lead to delayed diagnosis and treatment as well as increased morbidity and mortality. In conclusion, health disparities for immigrants in the United States are a complex and multifaceted issue that require a comprehensive approach. To address these disparities, policymakers and healthcare providers must work to improve access to affordable, culturally competent, and linguistically appropriate healthcare services for immigrants. This includes expanding access to health insurance, improving language access, and promoting cultural humility and sensitivity among healthcare providers. By addressing these barriers, we can help ensure that all immigrants have the opportunity to achieve optimal health outcomes and live healthy, fulfilling lives in the United States.